So Care for Her is the women's health division of MCHC, and it's where we provide obstetric and gynecologic care to women of all ages, pregnant and non-pregnant, from basic services to invasive surgery, minimally invasive surgery, birth, prenatal care, and woman care.
I honestly think it's unique in the country. It's not just unique to the state or to this region. For example, we have 8 nurse midwives that provide most of the obstetric care, primary obstetric care, a midwife. It's a very good, well-rounded, quality women's healthcare program.
In traditional practices where midwives see low-risk births only or low-risk prenatal care, the patient wanting that individualized experience and that midwifery attention often are, risked out of a practice and sent to OBGYNs that, may or may not provide that same service. And so with the supportive collaboration that we have, they're able to stay in our care and get that unique experience even while they're having more medical oversight by the doctors for their high-risk conditions.
I feel really blessed that I found this career. The job here is really unique in that we get to be the first provider that the patient sees and works with, and all of our patients, whether they be low risk or high risk, they get midwifery care, which we know the outcomes, the evidence shows that there's better outcomes for women with vaginal birth, with breastfeeding rates, with reduced risk of postpartum depression when they get midwifery care. However, we have a really high risk population and a lot of folks with complex psychosocial or medical backgrounds. So our practice is unique in that we get to leverage the physician's strength as well. And each patient gets not only a midwife, but an OBGYN physician that can also support them if it's needed.
Well, I think it's really the best of both worlds to work in a collaborative practice because the midwives are really the experts at normal pregnancy, normal birth, and the physicians are really the experts at complications. And I think when we work together, we're really able to give whole woman care to everybody that comes to us.
Anyone who is insured or uninsured or underinsured, no one gets turned away. It's easy to make referrals within the organization to give them access to care to serve all their healthcare needs.
We have a model at the clinic that includes midwives, and it's been running very, very successfully for almost the full life of our clinic for 30 years.
Mm-hmm. You get to see multiple generations of mothers come in to the hospital. I may have talked to a few folks and that have been here for a few years, and that joy they get from delivering the grandchildren of someone they delivered a couple years ago.
What we do in our field is quite stressful, so to have each other's back and to help each other when it's needed, it's really welcomed every day. I've found the difference between my private practice previously and here is that I used to continuously, constantly work all the time there at a slower pace. Here, it's a faster pace, but for a shorter period of time, and then you get to take time off. So that's really nice.
One of the things I really like about working here is all of the providers work well together. And that, what I mean by that is not just the people that work directly for Care for Her, but the other providers that work in private practice or for Adventist Health. We are there for one another, whether it's in consultation, we work in the operating room together. At any time of the day or night, we can call each other and ask for advice and ask for help. And there's never a hesitation to come and help.
I'm really, really happy with the partnering that we've seen over the last few years. And I think that's due in large part to Judson's leadership there. And his openness to saying, yeah, I can't do this by myself. I need partners to come in and work with me. So it's been exciting, and I think we're really starting to turn a corner there to a point where we're not burning our providers out. And
it's exactly that. How do we create sustainability? Right. So what's that empathy? Or how do we design empathetically, for the physician, right? Mm-hmm. So they can have that work-life balance that they need. And the reality is, if we create 2 or 3 or 4 smaller practices in our community, you're creating non-sustainability and vulnerability for those practices. And I think we're on pace for about 900 deliveries this year.
Yeah.
In this community, so it's a substantial volume, and what a great place to practice.